What does the informed consent process for citalopram, otherwise known as Celexa, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And today we're talking about citalopram, or Celexa. Now you might notice that this sounds quite a bit like escitalopram or Lexapro, and that's because Lexapro is the enantiomer or mirror image of citalopram. So they are biochemically basically equivalent. And so usually if someone responds well to one, they will respond well to the other and vice versa. Citalopram is one of our selective serotonin reuptake inhibitors, or SSRIs, which is one of our most commonly prescribed classes of medications in psychiatry. Citalopram is FDA approved for use in treatment of major depressive disorder, and that's its only FDA indication, but it certainly is used off-label for a number of other conditions, including things like generalized anxiety disorder, social anxiety, PTSD, panic disorder, OCD, and many others. It additionally can be used off-label for certain somatic indications like premature ejaculation and perimenopausal hot flashes. Some things that are unique to Celexa are that it carries an additional black box warning due to its risk of QTC prolongation. So basically what this means is that it can slightly change how your heart beats, meaning increasing the QTC interval, which can put you at greater risk of a dangerous arrhythmia. So if you're on this medication, it's important to have an EKG on file, especially if you are on other medications that can affect the QTC interval, or if you have a cardiac history. For people who are age 65 and older, we don't recommend using doses greater than 20 milligrams for the same reason. Otherwise, the side effect and risk profile is going to look similar for Celexa as it would with most of the SSRIs. So side effects that I'm going to counsel patients about are going to include things like headache, dizziness, upset stomach, nausea, diarrhea, constipation. We're going to advise that people take this with food to mitigate that risk. It can be sedating for some, but it also can be activating for others, which can look like irritability, agitation, insomnia. And for those who are vulnerable, meaning they have maybe a personal history of bipolar disorder or a strong family history, there is also the risk of triggering mania. There also can be changes in appetite, which can lead to weight gain or weight loss. There also can be sexual side effects like decreased libido and difficulty achieving orgasm. Typically, these are going to resolve upon discontinuation of the drug. However, there are cases where this persists beyond that, and this is something called post-SSRI sexual dysfunction, which can take months to years to resolve. Additional adverse effects are that it does increase the bleeding risk slightly. It can also cause hyponatremia or low sodium levels. In addition to the black box warning that we talked about, there's also the same black box warning due to the risk of SI in adolescent populations, meaning through age 25. There's also the risk of serotonin syndrome, especially when taken in conjunction with other serotonergic agents. And for those who have an anatomical narrow angle, there can also be the risk of acute angle closure glaucoma, which is a very dangerous condition that can lead to blindness. Like all SSRIs, these can be quite difficult to get off of, especially the longer that you've been taking them. So I am going to recommend taking a hyperbolic taper approach, meaning decreasing by a set percentage of the dose with each dose reduction rather than by a set milligram amount. If this medication is tapered too quickly or stopped abruptly, then it does increase the risk of something called protracted withdrawal, which is a condition that can basically affect every organ system in the body and can last for years. If you're interested in that, then check out some of my other videos where I talk in more detail about that. But needless to say, it's not something that you want, and it's important to taper off slowly enough to reduce the risk of this happening. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list so that I can communicate with you all directly about resources or courses. So if that's you, send me a DM with your email, and I'll see you in the next one.